And welcome to the March episode of the VHL CCC Spotlight Series. Today, I'm excited to welcome Dr. Phil Spiess from the VHL Clinical Care Center at Moffitt Cancer Center in Tampa, Florida. In addition to being the sponsoring physician for the Moffitt CCC, Dr. Spiess is a senior member in the Department of Genitourinary Oncology and the Department of Tumor Biology, as well as the Assistant Chief of Surgery. He is also a full professor in the Department of Oncologic Sciences at the University of South Florida College of Medicine. Dr. Spiess is a native of Canada and received a master's in experimental urology surgery at McGill University and his medical degrees from the University of Toronto. Dr. Spiess completed a urologic oncology fellowship at the MD Anderson Cancer Center. The VHL Alliance is also very proud to include Dr. Spiess on our VHLA Clinical Advisory Council. Dr. Spiess, thank you for being here.
Thank you very much, and it's a privilege to be here with all of you.
When and why did you first decide to become a doctor?
So good question. So I think my decision to do medicine came a little later than most. I wasn't one of those kids at 2 years old or 3 years old that said medicine was what I wanted to do. I think I always enjoyed the sciences. I actually had a tendency to enjoying math, science, physics quite a bit. But really, I started really being interested in medicine by doing some volunteer work in the hospital and working on the floors and doing some research. And I worked with some urologists and some other surgeons. And my first exposure to research science and medicine were really things that intrigued me. And then when I actually went to the operating room, I was able to sort of be involved in seeing and then potentially participating in surgery. That was really when it's shown on me that was really my calling and something I wanted to pursue. And to this day, I tell people all the time, it's a great privilege and honor to be a physician. There's no greater, honor when someone trusts you with their health. I think that's the greatest level of trust and respect. And we're seeing it right now that I think healthcare workers are incredibly valued. And I definitely feel very privileged to be part of that group.
What got you interested in working with VHL patients?
So really, it was so when I came to Moffitt, I knew that my area of focus was going to be the care of kidney cancer, and really being at a busy cancer hospital and seeing some young people who were impacted with kidney cancer, I realized very quickly that we didn't really have a hereditary kidney cancer program at a major institution like ours. And that's really when I thought to myself, this is something that was critical for the institution and through the southeast of the United States. And truthfully, I found that the VHL Alliance was an incredible partner and resource for me and for the institution to work with. And again, I think the work that you all do is incredibly useful. And I feel very privileged to be part of your group and to work with you, because I think from everything I've seen, everything you do is all about caring for people and offering them really the best care and potential eligibility for clinical trials and education. And I think your mission is really a wonderful one and one I feel very honored to be part of.
Thank you. And we feel the same about you. It was really great when you guys hosted the annual VHLA Family Weekend in Tampa at Moffitt. I know that was a really great experience for everybody involved. And speaking of experiences, what has been the most memorable experience for you as a VHL specialist?
I think one of the greatest experiences I had was when I saw a young patient come in and I realized that they had a whole host of additional family members which could be impacted with this. And we're able to facilitate the screening of their family members and really pick up a few things that weren't very clinically significant, some neurological related issues, which could have been easily addressed before they became potentially fairly critical things. So seeing that by offering multidisciplinary care with a bunch of specialists, really caring, optimizing the evaluation and management of patients could have such a dramatic impact on patients, especially sometimes large families, was really meaningful. And I think you mentioned it. It really came together when we got to host the event at Moffitt. I will tell you myself, as much as all my team members, to see the attestations and really the discussions with the patients and the families about how this impacted them was really touching. And it was, I would say, for everyone involved in that room, it sort of gave everyone an increased level of awareness and energy that we continually need to do more for VHL and for hereditary kidney cancers as well, because you need to provide really the best care, and there's so many people could be impacted with these conditions.
What have you found to be some of the more challenging aspects of your job, and then what have been some of the more rewarding aspects of your job?
So I would tell you today, practicing medicine today is not what it was 10 or 15 years ago. I think logistically, as you all know, we now use EHRs, and there's a lot of paperwork, there's a lot of documentation. When I trained, you just wrote a two-line note on your patient doing well, see you back in 3 months. Today, I think that the level of dictation, administration, and effort you need to do in practicing medicine is more so than it's ever been. And that's why we see nationally some really high rates of burnout. So I think as a physician, and I know my institution is very dedicated to this, it's important to keep a balance in your life and in your practice, and to continually reevaluate that on a regular basis. And the most rewarding, truthfully, is when you're able to see that what you are able to do for a patient and their family is going to favorably impact them. It is the most rewarding thing. It's better than any award or any type of, recognitions you can ever give, because you know that a person and their family could be so positively affected by direct things that you have done. And I don't think there's many truthfully specialties or areas where you can do that and do that so effectively.
Yeah. How do you think, obviously with the current state of affairs, it might be sort of hard to predict, but what do you think the state of VHL care will look like in 5, 10, 15 years?
Great question. I think there's no question, obviously, right now we're going through a challenging time. All of us around the world, definitely all of us in North America, and the way we care for our patients. And I definitely think that's going to be with us for probably definitely the next few months, potentially even longer than that. No one really ultimately knows. But I think within the 10 to 15 years, I see a very, very bright future for the care of VHL and other genetic conditions, because I think the research is really getting to a level of sophistication and quality that we're starting to really be able to pick up not only genetic mutations, but find solutions how we could potentially target those using various forms of gene therapies. And we're starting to see some of these trials coming into fruition, but I think that's just going to continue to improve. And I do think, me and Josh were just talking before this communication. I do think also things like telemedicine, things like artificial intelligence, neural networks, we're able to optimize the care of patients using really very, very sophisticated models. It's just going to get better and better and better. And some of our treatments are also going to be improved, not by trial and error, but because we're going to be able to sort of develop clinical models where we're going to know exactly how someone's going to respond, because we'll have all the elements that could predict that. So I think there's a very bright future.
If you could give patients with VHL one piece of advice, what would it be?
It would definitely be as educated and as involved in your care as possible. I think it's always important to realize you're your strongest advocate, and you should never leave your doctor's office and have questions that are unanswered and you feel rushed. If that doctor or that team cannot answer your questions or take the time, then you may not be seeing the right doctor. And I would 100% agree that everyone is busy. But at the same time, your health is your greatest priority, is your greatest value. And you always need to feel very confident that people caring for you are putting that as the highest priority. And I do definitely think also things like the VHL Alliance are a wonderful resource. You have done an incredible job identifying centers that are dedicated to the care, physicians that are dedicated to the care. So I think you provide those additional resources to help do so. And I also think you do a wonderful job advocating when there's a somewhat complicated case or something which is out of the ordinary, reaching out to experts around the country or potentially internationally to answer some questions is something that you've done a really, really good job with. So the education, the resources are out there. Definitely always reach out to them to make sure that you feel confident in how you're being cared for.
Thank you. That's great advice. We always tell people you really have to be your own advocate and surround yourself with experts. Those are some of the best things you could do to ensure a good prognosis. So going back to physicians and the healthcare industry at large, why should doctors and medical professionals care more broadly about VHL?
Just because more and more, I think we realize that this affects a significant subset of patients. I think the effect of genetics in cancer today is realized more so than it's ever been before. We see a lot of the screening programs for various cancers are becoming broader and broader. For example, screening for patients with kidney cancer above the age of 40 is you should screen for genetic disorders. And so I think in the past, we probably under-recognized how many patients could have hereditary kidney cancer. And I think today, that's a larger part of who you may be seeing in your practice. And it's important for all physicians to be aware of it and to be looking out for it. Because again, identifying someone in a potential condition like this is something which can incredibly positively affect their care if you identify it very early and it's being monitored carefully. So I think everyone should really have a level of understanding, education, and I would say screening for that in their practice.
Now, obviously, you're everyone knows you as this amazing doctor, but you're not just a doctor. You're a human being just like everyone else. And I was just wondering, what other passions and hobbies do you have outside of the hospital?
So a good question. So I actually so I love sports. I'm a runner. You run marathons, half marathons, and in addition to that, I have a passion for car racing. Not sure if you knew that. I've done some car racing in the past. And continue to do a little bit of it, although with kids these days, that's a little more challenging. So that comes from a long heritage of car racers and motorcycle racers in my family for many years. So that's something I enjoy watching as much as participating a little bit. And truthfully, just family time. I'm very family oriented. I've got 2 awesome kids and a beautiful wife. And out of this crazy crisis that we're dealing with, one thing I'd say is probably spend a little bit more time with them. And that's actually been quite nice. I tell people it's clearly a stressful situation for everyone, but I definitely think I'm seeing my young ones grow up a little bit more than I would on a typical week or months.
That is, that's a crazy that you're a race car driver. So please make sure to buckle your seatbelt because we need to be safe.
Hey, I will, promise.
Yeah. So here's, I guess, a question from the live audience. How has Moffitt been responding to this coronavirus crisis?
So we were very proactive as an institution. We saw this probably coming definitely a few weeks to maybe a little longer than that. So I've been actually involved in our telemedicine and virtual health initiative at the Cancer Center for the last 2.5 years. So we really developed a very comprehensive telemedicine platform so we can care for our patients, minimizing them having to come to the office and seeing us. That obviously protects the patients, the families, and our team members as well. And then, we all talk about this PPE, protective equipment. It also allows us to really use that equipment only when we absolutely need to. I will tell you, Moffitt is very committed for caring for cancer patients despite a crisis. I know, unfortunately, some institutions in New York have had to completely shut down, but I tell people I'm still actually operating a few days a week on really the more aggressive cancers because some patients, unfortunately, their windows for cure is quite small, and we need to continue to care for those. And we're trying to really even enhance our ability to care for cancer patients across the state of Florida while other institutions are still struggling managing a lot of coronavirus patients.
So that's actually a great lead into the next question is about for people who have surgeries, kidney surgeries scheduled that might have been delayed, considering that this situation there's no sort of known trajectory at this point, how concerned should they be? What steps should they take? What questions should they ask?
So great question. I think that's an important one, Josh. I'm glad someone asked that. So I think it's important to really have a good communication with the team that's caring for you at that institution to understand a little bit about your cancer. What's the stage? What's the grade? What's the likelihood this could progress? Are you having any symptoms? Are you not? And if this is a tumor which has some aggressive characteristics, to see if they could be cared for. It's important to make sure that if they need surgery, that'd be done in the appropriate timeline, particularly if it's a more aggressive one. And if those institutions feel they can't do so, then definitely maybe see with their physicians if they potentially need to be referred to other places where they can get cared for. You know, I definitely get it. Some patients, like many of my patients, are very attached to their physicians, but if they can't get timely care, it's important at the end of the day that they sort of get that care and it be done appropriately.
So with that, Dr. Spiess, I just want to thank you so much for everything you do for our patients and for taking the time to talk to us today. This has been really wonderful.
It's my pleasure, Josh. And I definitely, again, I really want to applaud everything you and the whole VHL Alliance have done for patients and their families. And again, one of the greatest privileges I've had since I've started working on Moffitt was to be involved with you and to see how we've developed that program. And I'm looking forward to working for many, many more years with all of you.
Thank you. Same here. And for everybody who wants to find more information about the CCC at Moffitt, please go to vhl.org/Moffitt. That's MOFFITT. Thank you again, Dr. Spiess. You could find all of the CCC Spotlight series at vhl.org/Spotlight. Thanks again, everybody. Thank you for joining us. Stay safe and have a great day.
Thanks. Take care. All the best.